Well, let me begin by, first of all, thanking these wonderful men and women standing behind us, including my colleagues, but obviously these people who come from the medical profession, families and others who are deeply interested, deeply concerned, passionate about the issue of whether or not we're going to be able to change the current system, which is a broken system, an unsustainable system. There's a lot of debate about what we need to do, what we ought to do. But I don't know of anyone who's looked at this issue for more than 5 minutes who would conclude that the status quo is acceptable. It is totally unacceptable. And so we have no choice, in my view, but to change the system, to reform the system, to step up and do the job that the American public are asking us to do. And that is to create accessible, affordable, quality health care. And that is our common determination, my colleagues who are standing with me, and I believe others across the so-called partisan divide here, to come together to formulate a plan that will achieve those goals of driving down cost, expanding accessibility, providing quality health care for all Americans. That's our determination today. Senator Kennedy, of course, is our driving spirit, the person who has spent 4 decades of his life committed to this issue. And no one wanted to be here more than the rest of us except himself to be a part of this thing. And he is in so many ways as a guiding inspiration about our determination to achieve those results. And our hope is in the coming days, he'll be joining us at some point here to carry on this debate. I'm a designated hitter until he gets back here, and no one wants him back here more than I do, to be a part of this and to lead this effort. He means so much to this. I don't want to spend a lot of time boring you with a lot of details. Many of you know it already, consuming 18% of our gross domestic product already. The estimates are that 35 cents out of every dollar could be spent on health care costs in a matter of just years, a few years. That 1 out of 5, 1 out of 6 Americans are without health care coverage. And as we learned only a few years ago, that at any given point in the year, and particularly in these days with so many people out of work, that as many as 85 or 87 million Americans at one point or another had no health care coverage during the year. Now, we can talk about these numbers and statistics, but behind them are real people, like some of the people standing behind us here this morning, this afternoon. That family who finds themselves out of a job and simultaneously finds out their child is in desperate need of health care. How are they going to pay for it? That woman, that worker, that job holder, who all of a sudden finds that that insurance is no longer there at a critical moment when they need it. And that happens every single day all across this country. We find that infant mortality rates are the highest among the industrialized nations. 100,000 people lose their lives every year because of avoidable medical errors. Statistics that ought to be shameful in a nation as affluent, as well-heeled as our country is. And so we've got our job to do in order to correct the system. Let me just say at the outset that as Democrats here in the Congress, we're not interested in changing a system for the sake of changing it. If you like what you have, you get to keep it. We believe in choice. If you ought to be able to choose your doctor, choose your hospital, choose the kind of coverage you want to have. We're not interested in changing that which works. We're interested in reforming that which doesn't work, and a lot doesn't. And we spent a lot of time over the last number of months, in fact, going back a year or more, sitting with each other, the staffs working together to formulate the bill that we introduced last week. We're going to start a markup tomorrow. We're going to have more meetings today, so-called walkthroughs with our colleagues to listen to their ideas and thoughts. They've introduced a number of amendments the Republicans have on our committee. But my determination is the sort of fill-in for Senator Kennedy is to move this process along. My hope is we can achieve bipartisanship. I've said that all the way along here. Nothing would make me happier than to have us come out with a strong bipartisan bill. And I begin the process with that goal in mind. Not to achieve bipartisanship and a weak product, but to have a strong product that's endorsed by people across the political divide in the United States Senate. I still believe that's achievable. I still believe it's achievable. Our determination, again, is accessible, affordable, quality health care. Senator Kennedy asked several of our colleagues on the committee back a number of months ago to take on some significant responsibilities. He asked Senator Tom Harkin to examine thoroughly the issue of prevention. One of the major cost savings for us, this bill, will be to avoid people showing up at a doctor's office or a hospital altogether. Senator Harkin's not here this morning, but has done a terrific job on that issue. Senator Mikulski of Maryland was asked to take on the issue of quality, to look at how we can improve the delivery systems, the quality of health care in our country. And between and Senator Harkin and Senator Bingaman, who took on the issue of coverage, I think had some 11 or 12 hearings just on those three subject matters alone since the first part of the year. And Senator Patty Murray of Washington has taken on the issue of the workforce issue, the delivery. How do we get the people, the healthcare providers, the technicians, the primary care physicians and others, the numbers we need in order to serve that expanding population as a result of increased accessibility? And so I'm going to ask each of my colleagues here to share a few words with you about this, and then we'll open it up for any questions that you may have about the process. But the process will begin, and it's a first step in a process. But again, the goal is to achieve that accessible, affordable, quality care, allow people to keep that which they have and like, and to, first of all, and secondly, fix, of course, the problems that are not working well and in desperate need of reform. It's an economic issue. It's also a human rights issue, in my view. It's a question of providing that which people ought to have. This is not an optional commodity. This is not about what sort of a car you want to buy or whether or not you think you ought to have a TV or not. An American gets sick and is in trouble, they ought to be able to have the comfort of knowing they can be helped. And they ought not to be determined by how well off you are. It ought to be determined about how well we can make you, how we can avoid you falling into that health care problem.